Traditional health insurance has gotten very expensive with high deductibles and huge emergency room costs. And sometimes it can take weeks just to get an appointment. But now imagine going to work and seeing a doctor at your job inside a private room, and it's all paid for by your employer, leaving you with no deductible. One local auto dealership decided to take a chance and choose a new employer-funded health insurance plan. And the owner tells me it's been worth the risk.
It had everything to do with the price of insurance for our employees and the lack of benefits that they got.
Greg Belasco owns Lakeland AutoMall, and after years of the rising cost of health insurance coverage, he was fed up.
And every single year we had to fight with the increase of premiums that I would have to pass along to the employees.
Healthcare is normally the #2 largest expense after payroll on any corporation's budget.
Liz Antaya, the dealership's employee benefits advisor, convinced Belasco it was time to think out of the box. Instead of the dealership continuing with one of the big name insurance companies like Blue Cross or Aetna, Antaya helped him create an employer-funded insurance plan.
We can offer better, higher quality medical care to your employees at less cost.
By customizing to their needs, Antaya created a doctor on-site option for the dealership every 2 weeks, so employees wouldn't have to miss work or wait for an appointment.
Back to what we like to say, the Marcus Welby days. So we're removing what we call the middles and going direct. The patients have 30 to 60-minute appointments, and they can access the doctor anytime they want. They have 24/7 access to him. He gives them their cell phone.
It's simple mathematics. If you have less patients, you can pay more attention, you can give more time to each individual.
Dr. Christopher Salud is the direct primary care physician, and this dealership doctor says he enjoys this new way of caring for patients.
It gets back to practicing medicine the way you envisioned it when you became a doctor, and it's getting to know people, spending time with people, and really helping them, versus coming in and seeing, patient after patient and not being able to spend time with people.
And it's not just about caring for their physical health either.
I'd say with every new patient visit, mental health or the mental health history is something that we're going to address.
With traditional insurance, Salud used to see up to 4,000 patients total per year. But now, with self-managed plans, he only sees 400 to 600 patients total because he's paid directly by the employer, a specific fee monthly per employee, almost like a gym membership. And even though they have complete access to him 24/7, he says it's manageable.
When a lot of physicians say, well, gosh, maybe I don't want my patients to have access to me 24/7. But once you get to know the patients and they know that they have that access to you, they're not calling you with little things. They call you when they need something. And oftentimes it's much easier to resolve.
I've seen the doctor several times, and he's been very helpful to me and very helpful to my wife as well.
Mike Kirkendall, who's in sales for the dealership's service department, says this new self-insured plan saves him money as well.
This is the first year that our out-of-pocket premiums have gone down. So while it saves the company, it's saving us as well.
Kirkendall says having his primary care doctor at the dealership every 2 weeks saves him time of needing to take off and wait in a doctor's office.
You can schedule your appointment during your work day. When your time comes, take your lunch break, step across the street to the building, see the doctor, go back to work.
And the savings of switching from a commercial plan to a self-managed plan can be substantial for a company, anywhere from 20 to 60%. And Belasco says that, along with better quality health care, is why he believes he's attracting the best employees and keeping them on board.
If we're taking care of them, if we're helping them to be healthy, if we're helping them make good medical decisions, then our retention has got to be greater. It has to be greater.
And employees like Kirkendall agree.
The quality of care that we get, I think, is better than we've ever had.
Also part of this self-managed insurance plan, the dealership signed up for something called the Nurse Navigator. So if Dr. Salud cannot address a specific health issue, employees can use the company's Nurse Navigator, an 800 number where a registered nurse directs them to a specialist. That's also free for the employee, paid for by the employer if they choose a doctor recommended by that nurse. Meanwhile, anyone can be on their own self-managed healthcare plan and use a primary care doctor for as little as $85 per month. If you'd like more information on how it works, go to our website, abcactionnews.com/ rebound.